Good morning. Welcome to the conversation on TOSTV Network, your digital first Pan-African news network. And by now you already know we're reaching you from Abuja, Nigeria's capital city. And of course, my name is Adesua Osuyi. Today we're going to be talking, we're going to be going a bit into health talks. Yes, that's what we're going to be doing on the conversation this morning. But before then, allow me to bring you COVID-19 updates from across Africa. And after that, it's straight into the big story. You're still here in the conversation on TOSTV Network, and by now you already know what I'm going to tell you. Yes, you have to join the conversation. Just join our community across social media platforms. It's TOSTV Network on Facebook, Twitter, Instagram. The channel to subscribe to on YouTube is TOSTV Network, and of course, share my website www.tostvnetwork.com for news, stories, and happenings from across the world. Now, straight into the crux of the matter. That's the big story. I did say earlier that we're going to be having a health conversation today. Yesterday, March 24th, the world commemorated World Tuberculosis Day. Yeah, that happens every year on March 24th, just to raise awareness about the devastating health, social, and economic consequences of tuberculosis, and to step up efforts towards ending it. And today on the conversation, we're going to be looking at Nigeria's health sector, but focusing on tuberculosis. And to help me discuss that here in the studio is Unamba Onyedikachi Joseph, a hospital pharmacist. Good morning and welcome to the show.
Good morning. Thank you for having me on the show.
Yes, you're welcome.
Thank you.
Let's before we get, I know the focus is on tuberculosis, but before we get there, let's look a bit at Nigeria's health sector. I know that the theme for yesterday's World Tuberculosis Day is looking towards more investment in tuberculosis to end that. But Nigeria's health sector has over time seen dwindling investment, government investment in that sector. And I think that's also replicated in investment in tuberculosis. What do you think about that one?
The issue is actually multifaceted. It's not just about tuberculosis, about things generally, even the educational sector. You see, we have a problem about it. But now about tuberculosis, the problem is just that the funding is supposed to be $13 billion annually. But unfortunately, we haven't gotten even more than 60% of such fundings normally. And so it has dropped because of COVID-19 2019.
Yeah.
And then it has been difficult ever since. So now the theme is invest to end TB, save lives.
Yes.
So because we actually want more people to invest in tuberculosis, because the funding has gone down, and without proper funding, you cannot screen, you cannot prevent, and you cannot treat.
Okay. Tuberculosis is an airborne disease, isn't it?
Yeah, it
so
is.
That means if someone has tuberculosis, it's very infectious, just like it is with COVID-19. I think it's a bit similar, these cases, right?
It's a bit similar.
So if COVID can be treated with so much seriousness, being an airborne disease, why do you think there's been a laxity, like a laid-backness in having to deal with tuberculosis, especially here in Nigeria?
Okay, now it's worthy to point out that tuberculosis is not just a Nigerian problem, it's a global problem.
Yes.
And so one of the reasons why it has been difficult to end it, because there's a sustainable development goal from WHO to end this pandemic by before 2035.
Okay.
And so the reasons why we have not been able to do that is because, number one, there's no rapid diagnostic test to actually confirm tuberculosis. And then number two, there's no effective and short treatment course for tuberculosis. It's usually 6 months, that's the least. And then number three is because the resistance is actually growing.
Okay.
And because people are not being compliant to their medications, and so it's actually a serious problem.
Okay. Is sensitization an issue when we talk about tuberculosis, like public awareness, education about it? Like, is it a problem of people not really knowing what the disease is, so preventing it is a problem?
The problem is not about people knowing about the disease. The problem is the treatment.
Okay.
Now, there is a problem with compliance because people don't take their medications the way they're supposed to. Tuberculosis has been lingering because it is a disease that is insidious. It is gradual. It's not something that comes one time. And so you have to treat it for 6 months. Now, you agree with me, if you have to take your medications for just 3 days, malaria medications, it's difficult.
I know.
Then imagine taking medications for like 6 months. It's a problem.
It's a problem.
And so that is why you have different phases of treating tuberculosis.
Okay.
So the standard is 6 months. If you are not compliant, it enters 9 months.
Oh.
If you're not compliant, it enters 2 years.
Oh.
And so it has a series of side effects that are difficult to manage. So that is why we have to educate people on how to prevent and then how to treat. These are the two major areas we have to focus on in Nigeria.
Okay, I do know that you have done some sort of activities. I don't know if humanitarian activity is the word, is how to put it, but in line with everything that we've been talking about. Can you just tell me a bit about that and tell me why you're very particular about tuberculosis and eradication of it?
Okay, yes, I have actually been engaged in community development services under the auspices of NYC in my community where I served, and then I was very active in bringing down the prevalence of tuberculosis. So actually have to collaborate with some non-governmental organizations. I have KNCV TB Foundation Nigeria. They're actually part of the contractors that USAID contracted to help bring down the spread of tuberculosis. And so I worked with them and their ad hoc staff in the hospital where I serve. And then they go out to the community, they carry out mass screening, and then people that are positive, they bring them to the hospital, and then they treat them. And they follow them up because it is difficult to actually make sure that these people take their medicine. So they have directly observed therapy to make sure that they take these medications the way they're supposed to take them. And then I'm so particular about it because it is also interesting to know that I was once a patient of tuberculosis.
Really?
Yeah. So I had to take the medicines for like 6 months and it was not funny. And after that, I determined in my heart that I was going to contribute my own quota to the public, to the community, to see how we can reduce the scourge of tuberculosis.
Okay. So you're saying that tuberculosis is entirely curable?
It is not just curable. It can be prevented through vaccination.
Oh, really? There's another myth that I think you should help me debunk. I know I've heard young people say, "Oh, tuberculosis is old people's sickness." Because you said you're a patient, you had tuberculosis at some point, and I was a bit shocked. Right? So this is not just like old people's sickness or something like that.
No, it's also worthy to know that tuberculosis has been present right from the ancient times. Because back in the days, if you check your Bible, you'll see where they mention leprosy.
Yes.
So the causative organism for leprosy and tuberculosis, they are of the same family.
Oh.
So tuberculosis has been existing since time immemorial. And then, yes, it is not just for a particular group of persons. There are people that are actually predisposed to coming down with tuberculosis. And then number one, people that are immunodeficient.
Okay.
People that have HIV.
Yeah.
According to WHO, a quarter of the world's population has some form of tuberculosis infection.
Oh.
And so it means that 1 in every 4 persons will have tuberculosis. You may even have it, you don't know.
Oh.
But you can live with it until you die and it does not present any symptom.
Yeah.
And it does not disturb you. As long as your immune system is up and doing, and then you are fine. So that's why people that have HIV, you check them for opportunistic infections. So the first one that comes to mind is tuberculosis.
Okay.
You understand? And so it's a very serious issue. So it can affect any group of persons. People that are at risk are people that are at the front line, the healthcare workers, and then you have children who are malnourished, and then you have people that are chemotherapy, cancer patients, because it suppresses the immune system. People on organ transplants, it suppresses the immune system. People that are treating autoimmune diseases, it suppresses the immune system. And so when your immune system is down, then tuberculosis can thrive.
Oh.
You get? And so,
Okay. So anybody can really be infected with
anybody
tuberculosis.
can come down with it.
Okay, so in 1 minute, we're wrapping up in a bit, but in 1 minute before, just to wrap up, how if you're going to give like a 2-point agenda on what we should do as a country, as a government, towards the prevention and eradication of tuberculosis, maybe just towards more investment, what should it be?
Okay, 1, the government should actually invest more in tuberculosis.
Okay.
Now 2, the developed climes, they are not talking about treating tuberculosis or preventing it. They are talking about donating to help other countries to solve, because development has a way of saving people from a lot of diseases. Now you can get tuberculosis from milk, unpasteurized milk from livestock. And so they pasteurize their milk and they have solved that problem. And then they have practices that you can do to prevent tuberculosis, like washing your hands. Most of us don't even do that. It was just until COVID-19 before we started. And then don't spit in public places, because this organism can survive in a dry state for weeks. And so if it's thrown up into the atmosphere, somebody can just pick it up. You get. And then you're also telling people to avoid crowded places. Anywhere you should be in should have proper ventilation, because it's an airborne disease. You get. So these are just the small pointers we can use to avoid it in our community and in our nation.
Okay. Thank you so much for sharing your thoughts with me in the conversation this morning.
Thank you.
Such a pleasure to have you. Thank you. And thank you for staying with me on Conversation today. Do not forget that I'll be back here, same time, same channel on Monday. Yes, that's because Conversation comes to you every weekday, Mondays to Friday. But before then, follow TOSTV Network across all social media platforms. It's TOSTV Network on Facebook, Twitter, Instagram. Subscribe to the channel on YouTube. It's TOSTV Network. And of course, through my website, www.tostvnetwork.com for news, stories and happenings from across the world. Thank you again. My name is Ade Sewell. See you and have a very splendid weekend.